Welcome back. Over the past decade, New York's Medicaid program has recognized the significant role health related social needs play in improving the health and recovery of nearly 7 million members. The state has taken a monumental step forward with the launch of the 1115 New York Health Equity Reform Medicaid Waiver Program. Here to discuss more is the founder and president of Scudder Intervention Services Foundation, Inc., Brett A. Scudder. Brett, thank you so much for joining us today.
Good morning, Brittany. Thank you for having me.
So to start off, can you just explain a little bit about the main objectives of the 1115 NYHER Medicaid waiver and how it aims to improve health equity here in New York?
Well, I think one of the things that we also have to recognize is that the Bronx has had the most health disparities for years, and our Not 62 campaign in the Bronx is to address those health inequities. And so now that Medicaid is now covering things like transportation, food, and other services that are critically needed for New Yorkers, we have to do more in terms of getting people to be aware of the waiver, the funding that's available, and the social care network that is run by Somos that covers the entire Bronx. And so, one of the things that we really want to do with this time that we have, Brittany, is to tell providers if you're a CBO or whatever services you're offering, please contact Somos to let them know that you're interested in learning more about the social care network and how you can be part of that because of the funding that's now being allocated for services through the Department of Health.
And how do social care networks function and what role do they play in addressing health related social needs?
So the Social Care Network is the main organization that was allocated the funding by the Department of Health. So if you are a provider, it's important for you to contact Somos to establish a partnership in that social care network so that you can talk about the services that you're offering, whether food, transportation, social services, whatever services that you're offering. It's important that they know who you are and know of those services because there's a part of the social care network's responsibility to connect people with the appropriate services after they're screened. So after the screening is done for Medicaid members, now that we know what their services are, it's important for us to know who the partners and providers are to connect with those services. And the system that is set up by Somos for the members to be part of will allow network partners to see who the Medicaid recipients are, what services they need, and who is providing the services to fill those needs.
Thank you for sharing that. I think at the top of our interview, you mentioned some of the things that they may cover, but for our viewers, can you tell us a little bit about what health disparities does the waiver seek to reduce and how does it plan to measure success?
Great question, Brittany. So I think one of the things that we really have to look at first is the fact that we know there are many pre-existing health challenges for residents of the Bronx. And so when we look at what the waiver is and what Medicaid is now covering for the first time in so many years that we've been asking for things like housing assistance, food insecurities, transportation, people who can't get to their appointments, who can't get to the places where services are being offered, that they can get people who are behind on their rent, who are falling behind on their rent for whatever reason. There's money in this initiative to help to bring your rent current as well as to pay ahead for you. But it starts, Brittany, with an assessment. The assessment is done when you contact Somos or you go to Somos website. You fill out that assessment. It will ask questions that are very important to you as a person. And then those questions will give Somos the opportunity to look at the services that you need and then connect you with the providers to do that. The reason why I'm saying this, Brittany, is because when you contact Somos or you do your assessment, you're going to see a much bigger picture here of what this social care network is about and what it will do. And the first important and the most important thing is to connect providers to Somos for the social care network, and then for Medicaid members to talk to whoever you're being provided service, wherever you go in the community or across the borough, you should be talking to those providers about joining their social network so you can get access to a lot of these additional services and resources that are available.
Yeah, absolutely. I think it's so important because everybody always focuses on the cost of treatment, which is hefty, but there's all of the costs on the back end for the patient and then also for the family members. Like you mentioned, food, transportation, all of these things that they start to add up, and treatment alone is extremely expensive. So then when you add in all these other costs, it does become very frustrating. It does become a major burden to deal with. And with that, there's $7.5 million allocated for this initiative over 3 years. How will these funds be distributed across these different programs?
Again, comes down to Somos, who is the primary social network lead that was awarded the funding by the
Hmm.
Department of Health. When you contact Somos as a provider, you're going to get what is called a fee schedule. That fee schedule is going to tell you what services are reimbursable. So there are regular services for Medicaid, and there are Medicaid managed care members who get the advanced services. The most important thing that we have to look at right now, Brittany, is the
Hmm.
fact that the funding that's there right now will fill a lot of critical gaps of what we already know are pre-existing issues. Housing is a very big one for many Bronxites, right? The cost of housing is so expensive. Even if you're living in an apartment or a home that you don't have the right services or tools that you need that will improve your quality of life, this is an opportunity for some of those things to be covered. But you first have to contact your health provider or your service provider and ask them, are you aware of the SCN? And if they are not, impress on them to join Somos Social Care Network so that that conversation of the services and what are offered. Food insecurities, we already know that access to food, access to good food, and the cost of food is very high and is getting higher. So if there is funding available, which there is, we should be doing everything we can to connect people into the social care networks to make sure that they're getting access to the things that will really be beneficial for them. Look at transportation. It's winter, sometimes it snows, sometimes it's so cold, people don't want to go outside. Now there are transportation resources within the waiver to get people to places, not just for food, but let's say you got to get to your doctor's appointment. Let's say you want to go to a pantry. Let's say you want to go to a yoga program or somewhere they're offering some kind of therapy or treatment, whatever that is. There is funding here to cover transportation. I'm not talking public transportation only. We're talking about ride share programs as well. A lot of people right now are struggling because they're behind on their rent. This opportunity is a separate program from a lot of the funding programs that are already there that can tap into and be used to help some of those needs, critical needs.
Yeah, absolutely. For our viewers, tell us a little bit. Let's shift gears and speak about some of the holistic approaches and how the waiver integrates behavioral health with primary care to provide holistic health services.
So look at it this way, Brittany. You're as a whole person, it's not just about your physical health. It's about your mental, your psychological, your environment, the people around you. All those things are what Medicaid is looking at now. Not just your health related issues, but how the social issues, environmental issues adds to you not feeling well, you not being well, whether you're dealing with mental health challenges or pre-existing health challenges. This opportunity now is saying we need to look at the whole person and how those challenges adds to the complications and stressors that people are feeling. And so this is why this is so important, right? Medicaid for the first time is really listening to the realities of what's on the ground and saying, yes, we do agree with you that if we took care of housing, food insecurities, transportation issues, these will help someone to feel better, to be better, and make sure that their health outcomes are better in terms of getting services and access to services.
Absolutely. And just as we wrap up, tell me what are some of the long term goals beyond the initial 3 year funding period?
Well, the goal is ultimately to show Medicaid that this worked. This is why it's so important to get people to be connected to the social care networks and for the social care networks to be working. Because at the end of this, we need Medicaid, the State Department of Health, to go back to Medicaid and say, hey, you gave us this money. We did a lot of great work with it, but we need more. We need this to be continued because of the values that we're seeing that is adding to the lives of people. And so, again, the first step is all the providers, we your church, food pantry, community-based organization, health community, whatever your role is, what you're doing, please connect with Somos. Let Somos know that you're interested in joining the social care network. Have a conversation with Somos about what the social care network is, what it does, get the fee scale of what services are reimbursable, and then you can know what you can do to serve a lot of the people who are in the areas that you're serving.
Absolutely. Brett, thank you so much for sitting down with us today.
Thank you for having me.